Welcome everybody, and thank you so much for joining the session of our global keynotes on the Health Data Forum, Global Hybrid Summit, and EU-India Mashup Day, which will be tomorrow. So today we are pleased to having here with us today as a global keynote speakers, David Novillo Ortiz, which is the head of unit of health data and information in the World Health Organization.
Thank you, Pablo. Hello, everyone. So for this introduction and for the opportunity to be with all of you today, it's much appreciated. So on behalf of the World Health Organization, the Regional Office for Europe, during the next few minutes, it's a short presentation. I will go over three topics. So first, I'll do a very brief data reality check, in particular, considering the wider effects of the COVID-19 pandemic. Second, I will go over some reflections on how we can overcome this situation, just some personal reflections. And finally, I will touch on some key priority actions that the WHO Regional Office for Europe is planning to develop in the framework of our recently approved European Programme of Work 2020-2025. So let's begin with a data reality check. Next slide, please. So as you may know, in September 2015, the 193 United Nations member states agreed on the 17 Sustainable Development Goals. From these SDGs, 12 goals, 33 targets, and 57 indicators have been identified as health-related SDGs. So in this map, you can see the availability of data to inform global health-related SDG monitoring. So unfortunately, as you can see in this map, the availability of recent underlying primary data is uneven. So for most countries, and recent primary or underlying data were available for between half and 80% of the health-related SDG indicators. For almost 1/5 of countries, however, over half of the indicators have no recent primary or direct underlying data. So for example, according to one of a UN report, some countries in Africa and Asia, on average, have data available to monitor only 20% of the SDG indicators. So this clearly shows that significant gaps exist in the availability and quality of data to inform global health-related SDG monitoring. Many national health information systems require urgent improvements, starting with not only greater investments in human and technical resources, but also in interagency collaboration. So strengthening health information systems is a core priority for WHO to ensure that countries have the basic needs to work in the digital age. Next slide, please. Another important fact, this one connected to the COVID-19 pandemic, is that along with the work of health workers, data are a key tool to effectively tackle this pandemic. So during these unprecedented times, I have had the opportunity to lead response teams on the ground, and I have seen firsthand that data are more urgently needed than ever to inform critical interventions. So in particular, to learn about the epidemiological situation, healthcare capacities, including health system functions, public health capacities, and availability of effective pharmaceutical interventions. Data are also needed to determine multi-sectoral and non-pharmaceutical measures, such as lockdowns or temporary suspension of socioeconomic activities. And finally, to monitor the wider effects on population health, because this pandemic and the actions taken to control this virus have an impact on population health beyond the direct morbidity and mortality it has caused. The range of these effects is broad and include, among others, disruption of health services and social, economic, and psychological impacts. Despite the progress achieved using digital solutions, the power of data has still not been leveraged. So now, of course, we have learned a lot from this pandemic. So for example, it has reiterated that real-time data and effective integration of different data and information systems can facilitate effective, timely, and data-driven decisions. It has also highlighted the consequences of a lack of health data standards, a delay in receiving data, a lack of integration and interoperability between different data systems, and an insufficient number of trained people to properly manage and use data. So in this first part, I just wanted to highlight the importance of robust data and the current challenges and data gaps that countries are facing, even when there is political commitment at the highest level. Next slide, please. So with this data reality check in mind, we now move to some ideas that countries should consider on to address these barriers in the context of the new normal. So this is the current situation. As you know, COVID-19 pandemic has not ended yet, and until there is an effective vaccine or treatment, everyone remains at risk. So we all need to work together to protect ourselves and others. So in the context of data in particular, we also need to consider this new normal. And for this, I would like to just suggest some principles and steps. So first, as key principles, we suggest 4 actions that member states should agree to be successful in mitigating the health, economic, and social impacts of COVID-19 and beyond. So these key principles are: facilitate data comparison and secondary use of data, enhance the monitoring surveillance systems, also exchange relevant data, and finally promote a data-driven culture to allow that everyone is able to access, use, and manage data. And if we want to be successful in executing these principles, there are 5 steps that member states, countries should work on together. So first, to establish a high-level data coordination mechanisms in charge of implementing a data governance strategy composed of multi-stakeholder partners. Second, to define data flows and processes which could be manual or digital. So not everything is digital. So also having good processes documented, even they are manual, is super relevant. And third, to adopt data standards to facilitate integration, interoperability, and forecasting at the national and the global level. So these first 3 steps are critical to success, and every country should move in that direction. The next 2 steps that I'm going to propose are equally critical, but will depend on the availability of financial resources. So the first one is to invest in data and digital technology because it is essential and will facilitate the automatization of different data and measurement processes. And according to the Paris 21 Partner Report published last year, international funding for data and statistics is only around half the level that it needs to be, which means that a lot of work is still needed on that end. The last step is related to empowering citizens, since everyone needs to understand the rights, the benefits, and risk of sharing data, especially related to ethics, privacy, and security. So the implementation of these ideas will lead us to an environment where political decisions are data-driven. Next slide, please. Countries are not alone in this journey. So to achieve these recommendations, countries can, of course, rely on institutions such as the European Commission, the OECD, or WHO. So in our case, the WHO Regional Office for Europe, I am pleased to inform you that 1 month ago, ministers of health and public health leaders from the 53 member states of the European region endorsed a new 5-year vision, the European Program of Work, that we call EPW, that it will be in place from 2020 to 2025, that sets out how WHO Europe and its member states will work together to meet citizens' expectations for health, including strengthening data and health information systems. So under this program of work, under this EPW, and in regard to health data, we are committed to developing big data capacity in surveillance, modeling and policy monitoring, also developing a European health data governance framework through a European health data governance charter, and complementing classic data collection by robust use of big data, online surveys, consensus panels, and experts' opinions. So in particular, these actions will help us address the recommendations made by the 194 WHO member states during the last session of the WHO Executive Board that was held in May. So from a data point of view, these actions will contribute to reducing data fragmentation and the reporting burden on countries, It will also enhance the capacity of data systems and increase data availability. So the question is, how are we planning to do this? So first, with you, with your collaboration, and in close coordination with key partners, such as the European Commission or the OECD, and other international organizations such as the World Bank, by setting up a new data team considering the new normal. Second, by reviewing the available evidence, something that we are currently doing in the fields of big data and artificial intelligence, and for which we expect to show some results by the first quarter of 2021. And of course, by making this evidence available to decision makers to facilitate investment and adoption. And third, by providing technical support to countries on the ground. So if we work together, we are convinced that it is just a matter of time before we will be able to provide the right data in the right place and at the right time to leave no one behind and make a measurable difference in people's health. So, and with this, I conclude my presentation. Thank you so much for your attention. I look forward to any question or comment that you may have. And in addition, my email is on the first slide of this presentation. So please feel free to reach out to continue this conversation. Thank you so much.
Thank you so much, David, for this short, concise, but very, very effective presentation. It's so interesting to realize that the WHO is gaining such a tremendous important role now in the context of the Brexit, right? So it's so interesting to see, and I'm very, very glad to see that you are quite active, busy, and congratulations for this framework that you have reached to facilitate among these all the states of the region. Congratulations, David. It's very important. It's for me a novelty and a surprise.